If you want to know what are signs of improvement when weaning off a ventilator in intensive care, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care today. So once again, what are signs of improvement when weaning off a ventilator in intensive care? It's a question we get quite frequently, and there is a distinction when someone is ventilated in intensive care. One way to ventilate someone in intensive care is with a breathing tube. One way to ventilate in intensive care is with a tracheostomy. And another way to ventilate is via BiPAP or CPAP, mask ventilation. But today we really want to focus on mechanical ventilation with a breathing tube and tracheostomy. So let's just start. When weaning off a ventilator, signs of improvement typically include the following: stable vital signs. The patient's heart rate, blood pressure, and oxygen saturation levels remain stable without the assistance of a ventilator. Breathing comfort. The patient begins to breathe more easily on their own with less reliance on mechanical ventilation, showing normal respiratory rate and effort. Number 3, improved blood gases. Arterial blood gases show normal oxygen and carbon dioxide levels, indicating that the lungs are functioning better. Number 4, decreased ventilator settings. The need for high ventilator settings like high pressure or high oxygen concentrations decreases as the patient is able to breathe independently and efficiently. Furthermore, the need for high ventilator settings also means not being in a controlled ventilation mode such as SIMV or ACV. It means moving from a controlled ventilation mode to a supportive mode such as CPAP or pressure support. Next, normal or improving lung function. The patient may show improvements in lung function through tests like spirometry or imaging such as chest x-rays, such as reducing the severity of atelectasis, which is lung collapse, or resolving pneumonia. Next, no signs of respiratory distress. The patient can speak, cough, or clear their airway without difficulty, and they show no signs of respiratory distress, i.e. labored breathing, use of accessory muscles. Next, stable mental status. The patient is alert-oriented, demonstrating adequate oxygenation and neurological function without confusion or agitation. Now, I will say this: when someone doesn't have a stable mental status and is ventilated via tracheostomy, they can still be weaned off a ventilator. Now, this is going to be very difficult. If someone doesn't have a stable mental status and is ventilated with a breathing tube, it's much more difficult to wean them, potentially triggering a tracheostomy. But that is not the purpose of today's video. Next, the patient is tolerating spontaneous breathing trials. The patient can successfully participate in spontaneous breathing trials, SBTs, without showing any signs of exhaustion, hypoxia, or hypercapnia. Hypercapnia means high CO2 levels, high carbon dioxide levels. Improved cough and secretions. The patient is able to clear secretions from their airway effectively, which is a good indicator of improving respiratory function. All of these signs suggest that the patient's respiratory system is recovering and that weaning from the ventilator can proceed. However, it is a gradual process, and some patients may take longer than others, depending on the severity of their underlying conditions. And that's really it. It is dependent on the severity of the underlying conditions. It's dependent on the length of stay they've been intubated for or on a tracheostomy for. It depends on whether they can get mobilized. It depends on whether they've been off sedation, right? It depends on a number of other factors as well, because what is really important during weaning someone off a ventilator is mobilization, breathing exercises, coughing, regular suctioning, right? But sitting out of bed, that is really important. I hope that explains the situation to you. And also, especially when someone is having a tracheostomy, there's also going to be some times when patients alternate between being on the ventilator and off the ventilator, for example, with a T-piece or a humidified trach mask or humidified trach collar or a humidified T-piece, right? So that's also, it really depends on ventilation with tracheostomy, ventilation with breathing tube. Right. So I have worked in critical care nursing for over 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.hotline.com. And I can very confidently say that we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecare.hotline.com. And you can also verify it on our intensivecare.hotline.com podcast section, where we've done some client interviews. Now, and that's why we helped hundreds and hundreds of members and clients over the years to improve their lives instantly when they have a loved one critically ill in intensive care. And I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I have, I'm talking to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you can't afford to get wrong. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And that's also why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecare.hotline.com by clicking on the membership link, or if you go to intensivecaresupport.org directly in the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. You also get exclusive access to me and my team, and you also get exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. And all of that you get at intensivecare.hotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecare.hotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my email newsletter at intensivecare.hotline.com, or if you are a subscriber to my intensivecare.hotline.com YouTube channel here. Thank you so much for watching. This is Patrick Hutzel from intensivecare.hotline.com, and I will talk to you in a few days. Take care for now.